Alright, this is shoulder range of motion testing for internal rotation. You're going to grab a foam piece to support the humerus so that it's aligned with the acromion process. She's going to start with her shoulder abducted at 90 and her elbow flexed at 90, keeping it neutral for no supination or pronation. And you're going to line up the goniometer with her olecranon process. The stationary arm is along an imaginary line perpendicular to the floor, and the mobile arm is lined up along the ulna on the ulnar styloid process. And then she's going to go into internal rotation, and normal range of motion is 90 degrees. Shoulder manual muscle testing, latissimus dorsi. You're going to start with your person lying prone on the table with their arm at their side. You're going to, with their palm up, you're going to instruct them to reach down towards their feet, and you're going to grab just proximal of the wrist, and as you're reaching down, you're going to resist pushing upwards, and that's it. She scores a 5. Alright, this is ankle foot range of motion testing for ankle dorsiflexion. You're going to start with your partner with their knees bent, dangling off the table. The axis of rotation is the lateral malleolus. The stationary arm is aligned with the fibula, using the fibular head as reference, and the mobile arm is lined up along the 5th metatarsal. And then as they go into dorsiflexion, normal range of motion is 15 degrees. Alright, knee manual muscle testing, semimembranosus, semitendinosus. You're going to start with your client prone on the table. They're going to go into knee flexion just under 90 degrees. You are going to internally rotate their leg, and you're going to grab just back here, and you're going to resist their flexion going backwards. And she scores a 5 as well. Alright, this is spine range of motion for cervical rotation with the goniometer. You're going to start with your partner sitting upright on the table, their head in neutral. Your goniometer for the axis of rotation is the center of their skull. For the stationary arm, it is parallel with their acromion, and the mobile arm is aligned with the tip of their nose. And then as they go into rotation, normal range of motion is 80 degrees. Alright, this is the spine manual muscle testing for the thoracic trunk extension. You're going to start with your partner lying prone on the table with just their mid-chest off of the table. They're going to start with both hands clasped behind their head, and then you're going to assist by holding down both ankles, and then they're going to extend into horizontal. And if they hold it there and don't show any signs of fatigue like she's doing right now, then they score a 5.